So now that we understand different types of infectious agents, let's make sure we understand some of the things we can do about it, the diseases that they cause. So you're familiar with a lot of these diseases, I'm sure. The viral diseases, HIV leads to AIDS. There's a lot of sexually transmitted diseases that are caused by both viral infections and bacterial infections. As far as viruses go, probably the three that will have the biggest effect on your life are the common cold, the flu or influenza, and of course coronavirus or COVID-19. As far as bacterial infections go, there's a lot of them. Everything from when you get an infection in a wound site to body odor and cavities to strep throat and food poisoning from salmonella and bacteria. Those are all caused by bacterial infections. There are other diseases that aren't caused by viruses and bacteria. That includes things like malaria and amoebic dysentery that are caused by protists. That's why you shouldn't drink pond water. Fungi cause things like yeast infection, ringworm, athlete's foot. Animals can cause everything from lice to having a tapeworm to scabies. So there are lots of infectious agents that can cause disease. Now, multiple different types of infectious agents can cause diseases that lead to things like gastroenteritis, which is basically an upset stomach, meningitis, bronchitis, and pneumonia involve the bronchi and the alveoli of your lungs filling up with fluid. Tonsillitis, conjunctivitis is when you get an eye infection or pink eye. Sepsis is when an infection, like a bacterial infection, spreads throughout the body. So there are lots of conditions that are caused by infections. It's also important when we're talking about these diseases to talk about how we get them. Now, some are foodborne. Some are, like the coronavirus, are mostly airborne. We inhale them. Some are transmitted through touch and through contact. And some are spread by what we call a vector. So a vector is when an insect, usually, although it doesn't have to be an insect, will be infected with it. In other words, will carry it, but won't actually have the disease themselves. So a common one is in a lot of parts of the world where malaria is common. It's very important you have a mosquito net because mosquitoes can carry malaria, and when it bites one person and then bites another person, it can spread it from person to person. That's also why you give your dog heartworm, is if they get bitten by a mosquito that's infected with heartworm, they can get a heartworm. The infection itself is caused by a worm, but it's spread by a mosquito. So what do we do about them and how do we prevent them? So obviously what we're hearing about a lot are the airborne methods of prevention, because that's how coronavirus is spread. So one of the reasons why they want everybody to wear a mask doesn't so much protect the wearer, because the viruses are so very, very small that it can get in anyway. You need to have one of those N95 masks that like really do a good job of keeping everything out to protect yourself. But by covering yourself up, when you talk and cough and breathe, you're always exhaling little particles. And so by wearing a mask, you prevent those from flying off into the air where other people can breathe them in. Obviously, staying away from people, covering your mouth when you cough when we're not in the middle of a pandemic, coughing into your elbow is important. Obviously, washing your hands, because anything that gets on your hands can get into your mouth. Recent indications suggest that COVID-19 isn't spread quite as easily through touch as they first thought. So touching surfaces isn't as crucial as protecting what you're breathing in, but washing your hands really thoroughly, making sure that you're not just washing like this, but you're washing like that and like this, and getting your thumbs and so forth. When it's something spread by a vector, having bug spray and mosquito netting, proper handling of food to kill bacteria. Sanitation is incredibly important. There's so much of the world that doesn't have proper sanitation. Being able to flush, for example, for the STDs and STIs. Having safe sex or abstinence, talk to your parents about that one. And finally, prevention. The best method of prevention is our own immune system, be able to fight it off, or a vaccine. I'm going to have you watch a video on vaccines. So let's talk about treatment. Sometimes we can't treat it. We can only deal with the symptoms. So for example, there is no cure for a cold, but we can treat the symptoms like taking medicine that will help drain the mucus. Other times, like for bacterial infections, we can kill the microbe. And so we do that using an antibiotic. Now, penicillin was the first antibiotic, but there's since been a lot of them. Antibiotics work by killing the bacteria without hurting us. And one way that they can do that is by destroying the structures that bacteria have that we don't. So it's mostly bacteria, not archaea, that infect us. And bacteria, one of their characteristics is that they have a cell wall made of peptidoglycan. And so peptidoglycan is not something we found in humans, and so we can destroy that, and that usually kills the bacteria. But it's super, super, super important to know that viruses don't have peptidoglycan. Viruses are not living. They cannot be killed by antibiotics. So when you have COVID-19 or the common cold or a flu and you go to your doctor and you say, give me an antibiotic, they should not do that. Antibiotics don't kill them. And remember when we talked about evolution, if we take an antibiotic and killed some of the bacteria off, but not all of them survive, what's left will be harder to kill because they have evolved to have a higher proportion of their population that can survive in antibiotics. So if we take antibiotics we don't need, they will become harder to kill. And so viruses aren't treated by antibiotics. We're just making the bacteria population that may not be making us sick at the time, get stronger. So don't use antibiotic unless you have a bacterial infection.